It is my pleasure to welcome Dr. Lindberg, a researcher at the Karolinska Institute in Sweden. Today, we'll be discussing his JACC interventions manuscript, reporting the revascularization strategies in patients with ST elevation, myocardial infarction, and multivessel disease. Dr. Lindberg, thank you so much for taking the time to join us and share your expertise.
Thank you, Dr. Al-Abcha, and thank you for the opportunity to join you and talk about our study.
First, can you give us a brief background, about the topic, the question that you and the team aim to address, and the population that you studied?
Yeah, so the clinical scenario that we studied is patients with ST elevation, myocardial infarction, so STEMI, who also have significant lesions in non-culprit vessels. So STEMI with multivessel disease. And over the past decades, several large randomized trials have shown that complete revascularization, meaning also the non-culprit lesions, is beneficial in these patients. And in accordance with this development in the evidence, cardiology guidelines have also moved towards favoring a complete revascularization approach in these patients with STEMI and multivessel disease. And what we wanted to study was whether and to what extent this shift in the guidelines and evidence has resulted in implementation of these revascularization strategies in clinical practice in Sweden. And in Sweden, we have the large Swedeheart registry, which we believe offered a great opportunity to address this question. So the Swedeheart registry, for those who are not aware, collects data on a large range of outcomes and clinical practice and clinical variables and treatment approaches, how patients are treated with myocardial infarction in Sweden. And the registry collects data on virtually all coronary angiograms from all cath labs in Sweden, and also can be linked with other national administrative databases that contain information on long-term outcomes, such as causes of death, rehospitalizations, and also repeat angiograms. And this collection of linked registries enables a practically complete picture of how patients with STEMI who undergo PCI are treated in Sweden, as well as the long-term outcomes with virtually complete follow-up without loss to follow-up.
Yeah, perfect. And thank you for highlighting this, because I think it is important to highlight the Swedeheart registry, because it is a unique registry that collects, almost complete data. And there are trials that are based on this registry. Kind of going back into revascularization in STEMI and multivessel disease, can you tell us more about the population and the results of what you guys found in terms of complete versus incomplete revascularization?
So from the Swedeheart registry, we identified a study population of approximately 20,000 patients. And these were patients who presented with STEMI and multivessel disease on the index angiogram and who underwent culprit PCI. And all patients had multivessel disease and were treated between 2009 and 2021. And these patients were classified according to the revascularization strategy as one of three categories. So first, incomplete revascularization. Second, angio-guided, so visually assessed complete revascularization. And third, physiology-guided complete revascularization, meaning complete revascularization guided by either fractional flow reserve or resting indices. And in terms of adoption, we found that throughout the study period, which spanned from 2009 to 2021, there was an increased adoption of complete revascularization from approximately 31% in 2009 to approximately 51% in 2021, although it appeared that the increase plateaued in the later years. And physiology-guided complete revascularization started being recorded in the registry in 2013 and had reached approximately 14% adoption in 2021. We then also assessed what patient factors determine the use of complete revascularization and found that these patients were slightly younger, had slightly less severe clinical presentation, fewer comorbidities, and were also more likely to receive other evidence-based pharmacotherapies post-myocardial infarction. And then we compared outcomes according to the revascularization strategy and observed that those who underwent complete revascularization had low risk of our primary outcome, which was a composite of death, repeat unplanned revascularization, and repeat myocardial infarction. And these differences were regardless of whether complete revascularization was angio-guided or physiology-guided, and they also persisted after adjustment for differences in patient characteristics.
Perfect. I think this is very nice and very important, kind of correlates with the some of the literature that we've had from randomized trials. And I think it's important to have real world data kind of corroborating that evidence. What do you think is kind of takeaway messages, or how do we move forward in terms of evidence in this topic?
Thank you. Great question. So first, I subscribe to the idea that trials tell us what we should do and registers tell us what we are doing. So when it comes to what we should do and when it comes to outcomes, large randomized trials have already shown that complete revascularization is beneficial, and our study adds results that support that this is generalizable also to the real world setting, first of all. But what our study primarily shows is what we are doing. And what we are doing is treat approximately half of patients with multivessel disease and STEMI with complete revascularization. And I think it's plausible that some of this, let's call it underuse, might be the results of appropriate clinical decision-making and prioritization based on factors that we cannot fully capture in the registry setting. But I believe more studies are needed to differentiate between appropriate and non-appropriate reasons for the plateauing penetrance of complete revascularization.
Yeah, I completely agree. And thanks again, Dr. Lindberg, for your time and for joining us today. And we invite everyone to go over the full manuscript and details published in this issue of JACC Interventions. Thanks again.
Thank you very much.